Good evening, everyone. I am Harsha, representing Science Integra, and I extend a warm welcome to all of you for the 20th webinar of Maha Smiles Cleft Care for Every Child. This event is organized by AMOX in collaboration with Smile Train India and the Public Awareness Committee of FOXY, with the aim of raising awareness about cleft lip and palate conditions in children. It is my pleasure to introduce you all to Ms. Renu Mehta ma'am, who is the Area Director of Smile Train India, who will be addressing us now. Over to you, ma'am. Thank you.
Thank you, Harsha, and good evening, good afternoon, everyone. Though Harsha has said a little bit about Smile Train, even if I'm repeating myself to the audience today, I would just like to share that Smile Train is world's largest cleft-focused NGO. We support safe quality care for children globally. And we, in India, we work through a network of our partner hospitals. Currently, we have over 125 partner hospitals across the country. And over 2 decades, in fact, 2025, we are in our 25th year in India, and we have supported over 750,000 cleft surgeries in India alone. We have been in collaboration with FOXY since 2019, and we are extremely grateful for this partnership with FOXY and with AMOX under the Maha Smiles Cleft Care for Every Child. This program is specifically for Maharashtra. We are focusing on this state with one aim, that any child that is born with cleft in Maharashtra gets the care on time through our network of partner hospitals. So this Maha Smile programs is a 3-year-long partnership with Bajaj Finserv, whereby we will be supporting over 8,000 cleft surgeries in Maharashtra through our network of 13 partner hospitals across Maharashtra. And if you find any cleft child, my request to you all is, please make them aware of our organization. Please refer the children to our nearest Smile Train partner hospital in Maharashtra. We also have a toll-free cleft helpline. The helpline is 1-800-103-8301. Apart from connecting through to our partner hospital, this helpline also helps in giving information to the children who are newborn. Sometimes we receive the calls where the mother is crying over the phone that I just delivered a child with cleft. How can you help me? So we have this helpline, which should be publicized within your community, and we will be able to help more and more cleft children. Without taking much time on this now, because I know we have exciting faculty here today, 2 sessions will be taken up. It is my privilege to introduce Dr. Monica over here. So I hand over to you, Dr. Monica, to take this forward. Thank you.
Thank you, Renu ma'am. And it is a proud privilege to announce that this is the 20th episode in succession that we are doing with the Smile Train. We do it every month, where one of the topic is for the awareness for obstetricians, and the second one is from the Smile Train regarding rehabilitation and surgical procedures for the cleft lip and cleft palate. And AMOX is proud to associate. And I thank the office bearers of AMOX, that is Dr. Kiran sir and Dr. Bipin sir, for allowing us to conduct these webinars. Today, we have the other stalwarts from ICOG, Dr. Parag sir as chief guest and Dr. Sarita madam as guest of honor. Sir, it is a privilege to have you on this platform with us, and I'm sure FOXY also will take this initiative to spread the awareness regarding Smile Train. Harsha, can we have the inauguration slide? With the blessings of Lord Almighty, we can begin with the program.
Sure, ma'am. So
Thank you, Harsha. Now I take on the opportunity to introduce our chief guest, Dr. Parag Beniwale, sir. Sir is currently the chairperson of the ICOG. Sir, apart from the academics, I want to say, sir has been the most approachable person I have met, whether it is Pune OBGYN Society or ICOG. He has been a postgraduate teacher and a unit head at Kamla Nehru Hospital, and the chairperson, the president of the Indian Menopause Society of Pune from 2018 to 22, and the past president of Pune OBGYN Society, the president ISOPAB of Pune chapter. We welcome you, sir, and please your words of wisdom today, sir.
Thank you, Monica. Good evening. I bring greetings from ICOG, and it's indeed a pleasure to be sitting here in the Smile Train program again after a long, long time. I had been a guest about a couple of years ago, and in fact, Ms. Renu, when Dr. Nandita Palshetkar, who was the president in 2019, had the first meeting with the Smile Train, I was one of the representatives of ICOG. I was secretary of ICOG that time. So I was very much involved right from the beginning of these activities. Thank you, Monica, Supriya, for getting me here and attend this program. In fact, the program today is very, very interesting because whenever we have baby born with cleft lip and cleft palate, there are so many challenges with breastfeeding, and who uh, better person than Dr. Charulata Bapai, who's the chairperson of the Breast and Puerperal Health Committee of FOXI, who will be talking to us about the challenges and the solutions. And of course, Dr. Parvati is going to talk about the psychological care in patients having orofacial cleft. So I'm sure it's going to be a great learning session for all of us. My best wishes for the program and all future activities. Of course, we can always continue our collaboration and spread the knowledge throughout. Thank you very much.
Thank you so much, sir. I request Dr. Supriya Arbari, the co-convener of the program, to please introduce our guest of honor, Dr. Sarita Bhalerao, madam.
Thank you so much, Monica. And first and foremost, again, I would like to congratulate AMOGS for being associated with Smile Train for several years now. A warm welcome to Dr. Parag Biniwale, ICOG Chair, and Dr. Sarita Bhalerao, who is the ICOG Secretary, and also all the societies that are associated with today's episode of Smile Train, that is Jalna, Akola, Sawangi, Ahmednagar, Chalisgaon, and Buldana. To introduce Sarita, she is one person like Parag who doesn't need any introduction to the August gathering of FOXI. But to complete the honors, a consultant obstetrician and gynecologist at Bhatia Sefi, Reliance and Breach Candy Hospital, secretary of ICOG, she's the sitting secretary at the moment, immediately past chair of AICC RCOG West Zone, president of Mumbai OB Society 2021-22, and past president of AWMI, also past secretary of the Indian Menopause Society, Mumbai chapter, and personally a dear friend, a very, very soft-spoken and elegant lady whom most of us look up to. Dr. Sarita, we would like some pearls of wisdom from your side as our guest of honor.
Thank you very much, Dr. Supriya, for those kind words. And I'd like to thank Dr. Monica for inviting me here as a guest of honor. And I can take this opportunity to congratulate both of you for doing this wonderful program in collaboration with the Smiles and AMOGS and also the Public Awareness Committee. And I can see that you really have got 6 or 5 or 6 different societies or more of Pune, Jalna, Akola, Savangi, and of course, Charu is from Pune and Chalisgaon and Buldana. So I really take this opportunity to wish you all the very best and congratulations. And I think it's going to be a wonderful evening with this program. Thank you.
Thank you so much, Sarita.
Thank you, ma'am. Thank you so much.
I think we can immediately now start with the
Start with the
scientific
first.
session.
Yes, ma'am.
Yeah. So let me invite Dr. Charu Bapai, again a very dear friend, the secretary, the chairperson of FOXI Breast and Puerperal Health Committee, and the most apt speaker, as Parag mentioned, for this particular topic. And to chair the session, I would like to invite Dr. Smita Kulkarni, who is the President of OBGYN Society of Jalna, Dr. Dipali Shukla, President OBGYN Society Akola, and Dr. Manjusha Agarwal, President OBGYN Society Savangi. May I request the chairpersons to please introduce our speaker?
Smita ma'am,
Smita ma'am is here. Can we have Dr. Charu CV?
I think it suffices to say that I am the chairperson of the breast committee, breast and puerperal health though. So,
Yeah. Is Dr. Smita Kulkarni here?
yes,
She
ma'am,
is
she's
logged
there.
in.
Ma'am, please,
Yeah.
can you
Hello,
unmute
ma'am.
yourself? Yes,
Ah,
ma'am.
yes. Yes, ma'am. Please introduce Dr. Charulata.
Okay. So it is my pleasure to introduce Dr. Charulata. Although I have heard her many times, and this is a nice opportunity for me to have a direct conversation with the topic of my interest, because these are the problems commonly faced. And I have a long list to read. I'm not going to read because we are more interested in listening to you. So, next
thank
week.
you so much. Thank you so much, Dr. Smita.
Thank you.
Yes, Charu. We
Yeah,
can start off with the scientific session. Yeah.
give me a minute. Yeah. Can
Sure,
my
sure. Yeah. Absolutely properly visible. Yeah.
So at the outset, I would really like to thank Smiles Train for initiating the whole process of helping out babies with cleft lips and cleft palate, because it is such a big trauma to the entire family when such a baby is born. And they're doing the good work for so many years together. So it is really a pleasure to meet Ms. Renu Mehta, and I congratulate them on the great work that they've been doing. What to say about Monica, Supriya? They are, trailblazers. They continue to do such amazing work, whether it is for their own organizations, whether it is for Foxy, or whether it is for organizations like Smile Train. So congratulations to both of you also. And of course, to meet the wonderful Dr. Parag Biniwale and the always smiling Dr. Sarita Bhalerao is an added treat today. So, it is going to be a great afternoon. I think, as Dr. Smita rightly said, this is the first time that we are really interacting with each other face to face. And so, Dr. Smita, thank you for chairing this session. All in all, when we talk about breastfeeding, the rates of breastfeeding, even in normal children, are so dismal. We know that close to 50% of babies, newborn babies, do not receive exclusive breastfeeding, whether it is in India or it is worldwide. So, can you imagine the problems that a cleft lip and a cleft palate can present? Because it is indeed going to be a very difficult procedure, but we all know the immense benefits of breastfeeding. And so, here we are going to talk about how to breastfeed these babies. Is it really so difficult? What measures do we have available today by which we can help these children is what we are going to find out. So we have no conflict of interest, and I would like to mention specially that Dr. Mangala Wani, who is a pioneer in the field of breastfeeding, and Dipti Shah have been instrumental in this PPT, along with the BPNI of Maharashtra. So thank you so much for sharing these slides with me. How often do we see cleft lip or palate? The incidence is 0.8 to 2.7 per thousand worldwide. The Asian babies, it is 1.7 per 1,000. It is interesting to note that clefts are more common in the Asian and American babies. Cleft lip and cleft palate are more in males. Cleft lip is more in males. Cleft palate more in female babies. Unilateral cleft lip is more on the left side, as close to 80%. The cleft of the lip occurs during the 5th to 8th week of gestation, and cleft palate occurs between the 6th to the 12th week of gestation. Why do cleft lip, cleft palate occur? There could be some genetic factors, there could be some environmental factors, smoking, alcohol, folic acid deficiency, excessive retinoic acid, exposure to German measles, which is the rubella virus, other infections, and some medications like anticonvulsant treatment or psychoactive drugs are known to cause cleft lip and cleft palate in the newborn. What are the types of clefts that we know about? It is unilateral incomplete, wherein you have only a bit of the lip which has gotten clefted. Unilateral complete, where the lip right up into the nose, that is a unilateral complete. And bilateral complete is on both the sides. I'm sorry. So, why does the cleft lip occur? The cleft lip is formed in the top of the lip as either a small gap or an indentation in the lip, which is the partial or the incomplete cleft. If it continues into the nose, it is a complete cleft. It is due to the failure of fusion of the maxillary prominence and medial nasal processes, that is the formation of the primary palate. Unilateral clefts of the lip are twice as likely to be on the left-hand side as compared to the right, is what we have already mentioned. What is the problem? You can imagine the agony and the trauma of the mother and the entire family when such a baby is born. Thankfully, today, these things are diagnosed way in time, maybe in the 5th month of pregnancy itself, ultrasonographically. Some couples tend to discontinue these pregnancies, while some couples either want to continue the pregnancy or it is not diagnosed as early as the 5th month. And then it is this problem which occurs when the child is born, that the couple is totally shocked. It was indeed a stigma once upon a time, and probably in the rural areas, it still remains a stigma. And the mother is totally in distress at the child's appearance. She already has gone through the process of labor and childbirth, and then to see a baby like this can be shocking to her. And then now to feed this kind of a baby is going to be even more stressful for the mother. So what problems are going to occur during breastfeeding? Because of the cleft lip, there is a trouble in maintaining a good seal and a vacuum as far as the breastfeeding is concerned. The baby is going to tire more easily. They tend to, prefer the side without the cleft. So, there is a diversion of the milk onto one side. Gagging and choking can occur. Because the baby is unable to suck very properly, the positive cycle where the baby is suckling well, and then there is more milk, and more the milk, the more the baby suckles, this positive feedback gets negated, and there's a reduction in the milk supply. The suck is going to be weak, and again, the baby may remain underfed. There can be nasal regurgitation and flow through the nose, and there is impaired growth and nutrition. And so the cleft lip is going to be a major hurdle in the growth of the baby. And so we have to help them out in this particular thing. How are we going to manage the breastfeeding? Can they breastfeed first and foremost? Yes, they can definitely breastfeed, but we ourselves as an obstetrician along with our staff need to be well versed with this. How do we help them to breastfeed? So cleft lip is oriented towards the top of the breast. So when there's a right cleft lip, you have to have the right-sided cross-cradle position. Okay. And if you want to feed from the left side, then you are going to, you have to have a football or a twin style of breastfeeding has to be adapted. Okay. So how do we go about this process? You latch the baby properly. Firstly, the mother is going to sit comfortably. The breast is going to be completely exposed. There should not be those feeding bras or material in between. The baby's cheek has to completely touch the mother's breast. And you're going to occlude the cleft lip with the thumb or the finger. The mother is going to do so herself. And then once it gets occluded, then the suction pressure will develop and the baby will be able to suckle properly. There is something called as a teacup hold also, which has been advised. And straddling like this, wherein the mother is sitting upright, she has the baby is resting on the mother's thigh. And in an upright position also, the baby can be fed properly. So these are the commonly recommended positions for breastfeeding in cleft palate. So we just saw that in cleft lip. Now what about cleft palate? Imagine that the palate has got a cleft. It is a congenital deformity in which the palatal shelves in the roof of the mouth, they fail to close during the early month of prenatal life. Cleft palate can exist in varying degrees of severity, ranging from a fissure of only the soft palate to a complete separation of the entire palate, including the gum. So you can have an incomplete cleft palate, a unilateral complete lip and palate, or a bilateral complete lip and palate, which is quite significantly difficult to manage. And sometimes there is what is called as the submucosal cleft palate, which is quite uncommon. But here there is cleft palate, but the mucosa remains intact, hiding the cleft underneath. And this may not be always diagnosed in time. What problems can occur in a cleft palate baby? Definitely, there are going to be difficulties in breastfeeding. Ear infection and hearing loss can be co-associated. Dental problems, if the cleft extends through the upper gum, the tooth development may be affected. Speech difficulties can occur, and challenges of coping with a medical condition, social, emotional, and behavioral problems can definitely be there. So how do we breastfeed over here? Here it is preferably the upright nursing hold or the straddle position is going to be necessary. If the mother's nipples are well protruding and the milk flow is normal, direct feeding on the breast can be possible and it is definitely going to be successful. But many times it becomes necessary to use some help. So you have something called as the Habermas feeder or a special need feeder, which is necessary to be used. And these are the ones which have a slightly longish, tip, because of which the milk is going to go directly inside. And then the chances of regurgitation will be less. And so these Habermas feeders are going to be required over here. Nowadays, there are some special bottles also available which can be used for this kind of cleft palate breastfeeding. And of course, the milk can be stored in these also, and we can use them for breastfeeding in a cleft palate baby. So what is different between a normal bottle and these special need feeders? Okay, they have a one-way valve, as a result of which milk cannot flow back. It is the air is squeezed out before the feed. The slit valve shuts between the jaw compressions, preventing the baby from being overwhelmed. That means too much milk also will not go inside. The speed can be controlled. The baby needs assistance, may apply a gentle pumping action to the body of the nipple. So I do not have much personal experience about these special need feeders, but from what we read over here, it looks as if it is going to be a fantastic device to assist babies with cleft lip and cleft palate. So how do we go about helping these cleft lip, cleft palate babies? Okay, immediately after birth, there has to be a first consultation with the parents, feeding advice, and follow-up for weight gain is very, very important. How many diapers does the baby soak? How many times does the baby pass urine? Is there a steady weight gain? All these things have to be looked into, because it is a well-known fact that in babies with cleft lip and cleft palate, there can be a little stunted growth because of inadequacy of the milk production, and of course, inability of the baby to suckle properly. So this is a very important thing that we have to look into. In the duration between 4 to 6 months, the cleft lip repair along with nose corrections is recommended. Between 8 and 12 months, cleft palate repair is recommended. Between 1 to 2 years, a hearing checkup to rule out middle ear collection to prevent infection is recommended. Between 2 to 4 years, a close watch on the development of the speech, regular dental checkup with the pediatric dentist is mandatory. Between the age of 4 to 6 years, surgery for speech improvement, which is necessary in 10 to 15% of the children after cleft and palate operation, is mandatory. Between 6 to 12 years, a dental checkup and orthodontic treatment if necessary. Bone graft for the defect in the alveolus at 7 to 9 years is recommended. What about the teenage years? Well, correction of the nose shape if the patient demands on orthognathic surgery to improve the facial profile is necessary. And in adults, genetic counseling to reduce inheritance of the defect is recommended. All these are the recommendations of the Smile Train project itself. So we can see that a team of people are going to be required. Obviously, the obstetrician who's going to support the breastfeeding, who's going to support the mother's mind and the psyche, because she's really traumatized because of the cleft lip, cleft palate baby. But we have to do a good job in supporting her, telling her it is not going to be a difficulty. We are all here to help you out. The plastic surgeon is going to operate on the cleft. The speech problem is going to be corrected by the speech therapist. The inheritance issues will be discussed by the geneticist. Hearing problem will be looked after by the ENT surgeon, and the care of the teeth by the orthodontist, periodontist, and the prosthodontist is what are going to be involved. So we have to encourage the parents to breastfeed and provide breast milk when possible. We all know the immense benefits of breastfeeding. We know that it is amrut for the baby. And we know that if these babies receive breast milk, they're going to definitely do better as far as their physical and mental well-being are concerned. So we have to help them with the different devices that we have talked about which support breastfeeding. Consistent and expert counseling should be provided by health professionals with clinical expertise in feeding infants with cleft lip. We have to provide timely assessment and support. Ongoing support for breastfeeding and involved partners is very necessary. Just one-time support is not going to be enough. The lactation consultant, the pediatrician, everybody will be involved continuously in supporting the process of breastfeeding. A timely referral to the specialist is very mandatory. They can join a peer support group because of which they will, their mind, their psyche will be in a positive situation that yes, there are other parents also going through the same situation, and how to help their baby by interacting with these parents will also go a long way. Local support group like these, like Smile Train, I think, and look for any other syndromes in the baby is also necessary. So telling about the suitable feeding position, teaching manual expression, how to use a breast pump, how to store the milk, how it can be stored for 3 hours outside, for 3 days in the refrigerator. All these things have to be explained very properly to the mother and her close family. We have to monitor the baby for good hydration and for weight gain also. Now, prosthesis. We can use a prosthesis, okay, prior to the surgery. It is like a plate at the level of the palate, which is used for orthopedic alignment. Strong evidence suggests that they do not significantly increase the feeding efficiency, but yes, these are available. Breastfeeding can commence or recommence immediately following the cleft lip repair and 1 day after the cleft palate repair without complications to the wound, which is a very good reference point. So we all know that mother's milk is the best milk. It is more nutritious and easy to digest. It's going to give a lot of good immune protection to the baby. It's going to lower infections like otitis media, GI infections. It's going to prevent obesity from developing. It's going to minimize allergies, helps the digestive system mature, protects against bowel problems. We all know that the gut microbiome is going to develop because of this breast milk, and it is probably one of the best protective mechanisms for the baby's gut. Post-op nutrition is going to be good. It promotes eye and brain development, and of course, it is extremely economical also. So we have to guide the mothers regarding that, just in case some problems do arise, we are going to here to help you and support you. So we're going to discuss the importance of breastfeeding during the antenatal period itself. Gone are the days when we talk about breastfeeding after delivery. Almost as soon as the mother, is pregnant, and as soon as you think that she is willing to, or she's in a physical situation to accept the input regarding breastfeeding, that is when the talks regarding breastfeeding are going to start. What about the role of the lactation consultant? Well, they are the ones who are going to initiate this early skin-to-skin contact. They are the ones who are going to talk about the positioning of the baby. How is the milk transfer going on? When milk transfer at the breast is insufficient or the baby is unable to latch, it is these lactation consultants who are going to help in the colostrum expression, the milk expression. They're going to teach the expression technique and the storage technique. Of course, they're going to talk about the breast massage, the pumping, and the use of galactogogues whenever the milk supply is inadequate. So I think lactation consultant is an upcoming branch. In metros like Pune and hospitals like ours, we definitely have a lactation consultant who is attached to our hospital, and they do a great job with the counseling and the support along with the feeding plan which is given by them to the mother to help her baby breastfeed well. The mothers are definitely worried that can my baby breastfeed directly in a case of cleft lip palate? Chances are more so with a cleft lip than cleft lip and palate. If there is a complete cleft of the lip and of the palate, it is definitely difficult to seal. And then express breast milk feeding with the help of a cup, a vati spoon, a bondla, or these special bottles are going to go a long way. We sincerely thank IBCLC and the BFHI for this wonderful presentation that they have helped us out with and for all their inputs. And although my talk ends over here, I have one more small PPT which I would want to just share if I can get a minute, where there are some very good inputs currently regarding the newer ways in which we can help out these children. Give me a minute. Let me see if I can share that. I don't think I can really see it, but okay, I'm sorry about this, but I just would like to share that nowadays with these 3D imaging systems, they can make the Haberman feeder, or they can help out with the feeders depending upon the shape of the baby's mouth. So it is customized for the baby completely. These are the newer things that are coming up. And I think that this is a great boon for every child. So as a result of which, these are the newer things that are developing, where the 3D printed feeding solutions are available, where customized feeding devices are created from digital scans of the infant's oral anatomy. These personalized solutions address the specific anatomical variations of each infant, potentially improving the feeding efficiency before surgical correction. So this is really going to go a long way. Telelactation services are today available, where telephonically, especially in remote areas where there may not be a lactation consultant, there may not be a very good team of people available, telelactation services are going to help a lot in treating or helping babies with cleft lip and cleft palates. So I think that medical science is going way ahead, and these babies are going to be definitely helped to feed well and do well. And the stigma of having a cleft lip and cleft palate is going to soon be eradicated because of the great surgeries that are being done through the help of Smile Train. So I thank all of you for giving me this opportunity to talk about breastfeeding in cleft lip and cleft palate babies. Thank you so much. Thank you, Monica, and thank you, entire team.
Thank you, ma'am. Smita ma'am and Dipali ma'am, you're there for your special comments.
Thank you, Charu, and requesting the chairpersons to make their comments.
Yeah, hi.
Dr. Smita is here, Dr.
Explanation, and I can see that implementing this in our practice makes a lot of difference and making the mothers happy. So you have covered all the ways, and even the role of lactational consultants also is very good because it is quite motivational for a woman who really gets depressed. So it was a very nice presentation. Nice to have you here to listen to this. Thank you so much.
Thank you, Dr. Smita, and thank you everybody for this opportunity.
Yeah, Dipali ma'am, are you there?
Dipali?
Dipali ma'am, please unmute yourself.
I think she must have. Yeah, I
Thank
think
you,
we can
Charu
go
ma'am.
ahead then. Yeah.
Thank you.
Thank you, Charu ma'am, for accepting our
Thank you,
invitation
Charu.
and being there.
Thank you
for an excellent presentation.
Thank you so much. Thank you.
Thank you, Dipali ma'am, and thank you, Smita ma'am, for chairing the session. We now move forward for the second session. Our chairpersons for today. Harsha, can we have the slides, please? Dr. Ganesh Pade sir has a diploma in endoscopic surgery. He is president of the Ahmednagar OBGYN Society. And he is in private practice since almost last 7 years, in charge of the OBGYN Department of Civil for the last 7 years. We welcome you, sir. Our next chairperson for today, Dr. Narendra sir, he's the president of the Chalisgaon OBGYN Society, and he's a consultant at Navjivan Hospital, Chalisgaon. We welcome you, sir. The next chairperson is Dr. Sadanand Ingre, sir. He is currently the president of the Buldana OBGYN Society, and he is as a specialty consultant at Khamgaon. Sir is busy in an emergency. He will join in some time. Ganesh sir is here, so I request him to please introduce our next speaker, Dr. Parvati madam. Ganesh sir, please unmute yourself.
Hello. Hello.
Yes, sir. Please go ahead. Hello.
He's there,
Ganesh
ma'am.
sir.
Just a second. I just spoke to him. Sir, the slide is on the
Good
screen,
evening,
sir.
everybody.
Yes, sir.
Yeah. To introduce Dr. Parvati Vidyanathan, Director, Doctorate Degree PhD, MS in Counseling and Psychotherapy. He is a clinical psychotherapist, Smile Train Project, Ganga Hospital, Coimbatore, providing psychotherapy to patients in the Cleft Clinic. Special focus on trauma, body image, and adolescent counseling. Board impaneled psychologists, various industries across India. Conducted over 3,000 counseling sessions with the executives. Uh, Provided support for work-related stress, addictions, and relationships, productivity, and mental health. Delivered 200 plus talks and conducted 350 plus workshops across India. Subject matters experts on mental health in corporate and healthcare settings. International leadership visitor program alumni in US Embassy. Nominated by US Consulate as a delegate from India. Recognized for her contribution to psychology and mental health. Thank you.
Harsha, please allow Parvati ma'am to share her slides now.
Yeah. Thank you very much, Dr. Ganesh, for introducing me. Thank you very much, Amox and Smile Train, for giving this opportunity to present this topic today. I'll share the screen. Hope the screen is visible.
Yes, ma'am, it's visible.
Thank you. So we are going to look at this concept today, psychosocial care in patients having orofacial cleft. So we believe in this concept that every smile has a story, and we see a lot of cleft children visiting our multidisciplinary OPD at Ganga Hospital, Coimbatore. And we are really proud to say that in this multidisciplinary, we were able to make a lot of difference for many children and the families. So the overview of the talk today is we are going to see about what is the perspective of psychological aspects with the cleft lip and palate. What are the standards as far as Indian society is concerned? We are going to look into insights of Indian experience. What kind of psychosocial aspects that we come across commonly in our clinic, the best practices that we have tried to incorporate, a few case studies and a few initiatives that we have tested in a couple of years, and we are happy to share it with you. So there is a very religious model to the psychological aspects of orofacial cleft, where we see that even today it is seen as in scientific layperson's approach. If we see, there are a lot of families who look at it like a curse, or sometimes they even look at it like a blessing. So there are many families when they come over here and we advise them to get the surgery done. There are families who have opened up and told us that we saw the horoscope, and this particular cleft lip or cleft palate is going to be lucky for my child. It is going to bring abundance and prosperity to the family. And we have been given specific time during which only we can do the surgery. And some of them also see the evil side of it, where they blame the mother. So we sometimes see mother coming with acute postpartum depression after delivery with the baby. When they come to the OPD, we see most of the time we spend a lot of time counseling the new mothers, because even today today, rural Tamil Nadu, there exists this practice of blaming the mother for any deviations from the normal, so believed normal standards. So, interestingly, when I was reading about this, we came through an article which talks about Hindu karmic theory, which also says orofacial anomaly. There is a mention in that, and they say these kids also have aggressive features. So that's how it is mentioned. And in Sanskrit also there is some mention about this. So before the Cleft clinic, before medical technology came into practice, there are still many rural and tribal families exist in Tamil Nadu who even today believe in prayers, who believe in appeasement, and they still follow rituals as a cure. So it takes a lot of time and effort for us to create this awareness that there is treatment for this. This needs to be treated, and explain to them the timelines of when they need to approach us for treatment. So the grassroots level engagement, we haven't still passed, and it is also parallelly happening with the population which is well aware about this. So we see population from both extremities in our multidisciplinary clinic. So what is seen as a deviation from what is a standard or normal, we see that cleft lip palate is a disability in the sense predominantly associated with not just facial features, but there is a social handicap because of speech and clarity. So most of the time, children cannot express themselves. So they show us emotional tantrums. They show us dissatisfaction of not being able to participate in discussions with friends, not being able to discuss with friends, not being able to be normal. So beyond 5 years, we see that it is a challenge for the child until there is an established speech. So the role of the speech therapist plays a very dominant role at this juncture, which actually makes a lot of difference to the child's whole psychological perspective, not only the child, but the family's perspective about the whole treatment. So when did this miracle happen? The miracle happened by corrective surgery. So gifted hands of the surgeons could do a lot of miracle to these children. And of course, an interdisciplinary, multidisciplinary team can make a lot of difference to the mental health of the child. So what do we see most of the times? With this cleft lip palate, we also see cases where the child has an associated condition like autism or ADHD or a oppositional deviant disorder or a pervasive development disorder with a specific learning disability. So this complicates the whole scene, and this is where a lot of integrated approach is required to lift the baby up. Parents, especially the mothers, they report a lot of emotional reactions. So it all begins from shock. So if this could be detected in antenatal, we see there are a lot of antenatal footfall in the clinic now. There is an increased awareness, and thanks to the wonderful contribution of the Obstetric and Gynecological Society in Coimbatore and around Coimbatore, where we see a lot of referrals to us, where we start the whole process with antenatal counseling. And later we see the mothers going into disappointment. There is a lot of doubt, shame, guilt, denial, and then there is a lot of depression. But over 2 weeks, when they continuously start coming to us, and when the multidisciplinary team starts to interact with them, we also have a practice where we let them interact with parents who have been through the whole process. And also we have group counseling sessions where we keep them informed about the whole trajectory of how this treatment is going to progress. And this relieves them a lot. So we also allow the extended family members to join the session so that everybody is informed in the family. So we see both internalizing and externalizing reactions from parents, where common complaints they tell us is we are not able to take the baby out anywhere because people question us, how did this happen? Why did this happen? There are even a lot of parents who came and told us, asked me, in fact, that is this because I was feeling very hungry, I was feeling hypoglycemic, so I had some snacks when there was a eclipse going on. Is this a reason why my baby has cleft lip and cleft palate? To that extent, superstitious beliefs still rule the community. So what we see in Indian experience is the orofacial deformity is often deemed as curse, and most of the time consultation it requires, we have also seen gender bias in bringing the child to the consultation. So now what we have done is we have tied up with RBSK, and we are trying to create this awareness in the population why it is important to get treated at the right time, and where the treatment is available. And we do a lot of awareness about Smile Train initiatives, and we talk to multiple populations frequently so that the awareness spreads. So what do we see as standards and judgments? So what we see preferably is there is a lot of worry among the adolescent population in CLP about aesthetics and facial features. And though they have trained themselves to be normal, but still subconsciously there is a lot. It is a standard of attractiveness and beauty. Sometimes people judge them based on intelligence and correlate it with CLP, personality, social standing. It's difficult for them to communicate, to have a friend or a partner. Trustworthiness goes down, and social skills. So this is what we see. And predominantly we see children really suffering because till 10th and 12th standard, they have been accepted by a friends group in the school. The real problem starts when they finish their 12th grade and they migrate into college. So this is the time where a lot of support is required for the adolescent when they migrate into college, because this new population predominantly takes a lot of time to accept them into their cohort. So what problems do these kids face? So, we create this awareness in a lot of schools. When kids come and talk to us about being bullied in school, we don't end up just counseling the kids, but we have gone one step ahead to ask the kids which school they are. And we have done a very awareness programs in the school to create awareness about what it means to be accepted. So, while talking to the kids, we have known that kids express to us what are the problems they face with orofacial defects, bullying and teasing, staring sometimes, which is very embarrassing for the child. So the child actually does not go to any of the social occasions. They just want to withdraw themselves. There are name callings. There are questions concerned with cleft lip palate. There's difficulty being understood. So children bully, laugh when there is something interaction required. This child abstains from asking any questions in the classroom or participating in any kind of group activities or discussions. And we see the child is extremely self-conscious, and eye contact itself is very difficult for the child to maintain. And most of the time, they are very overprotected by the parents, because since childhood to now, it has been a very tough journey for them. And when we put the child into a new social settings, there is a lot of discomfort is what we see. So the psychological factors, what we have seen, the core psychological factors of what we have seen is some of the adolescent children have also reported suicidal ideations. So because they don't belong to a group and they find it really difficult to transit from school to college and college to career, they feel very embarrassed and they just don't want to be. So this is where a lot of community support program comes. And we also have, we are also planning to have a support group started at Ganga Hospital for this initiative. Anxiety, depression, palpitations, we have seen twice in adolescents who have moved from school to college and then or completed college to career or career to the marital life. There are a lot of psychological problems strongly associated because of their appearance or, dentition in speech, etc. And we have also seen additional problems like behavioral problems where this child becomes extremely introvert, though the child has a lot of capacity to be social. So the whole personality has changed, and this change, what we see is actually a pseudo personality that the child is showing us because of the deformity. So when a child walks into the clinic, what do we assess? How do we assess the psychosocial aspects of the child? We look at the child's scholastic performance. So we look at the school performance. We see what is the classroom setting? How is the child accepted in the school? We also look at mental health symptoms like sadness, anger. What is the attention and focus capacity of the child? Does the child goes through any kind of anxiety, somatic symptoms? And we also look at adaptive functioning. Is the child able to participate in activities? What is the support system available for the child? Most of the time, some children walk to us with separated parents, single parents, or no parents. So, we have to go through what other problems the child is going through other than this. And we also look at any functional impairment like body image issues. Does the child have friends? Is he sleeping well? Is the child able to, help the family? Is the child able to normalize existing with the CLP? So this is the flow in which we assess the child. how do we give cleft psychology support here at the Ganga Hospital? So it starts from the moment the child is diagnosed. We talk to the family about the condition. We take them through the whole trajectory. We help the family to make decisions, and then the nutrition support starts. Post nutrition, we talk about any other psychosocial aspects, put them through the speech therapist, the surgery, and then the dental and other support treatments. So this is the flow in which every child goes through as a process in our multidisciplinary cleft clinic. So what do we do for a parental support? So a diagnosis cannot predict the extraordinary love you will have for your child. So here what we do to the parents is we talk to the parents about the psychological challenges they will face. We also talk to the parents about how they can accept the whole situation and what difficulties they go through. And sometimes we may also have to do extended family member counseling, like some mothers have come to us and told us, can you please talk to my mother-in-law about this? Can you please talk to my extended family members about what is this, the science behind this, so that they understand. So we have to go beyond the call of duty sometimes to do that. And these timely interventions have triggered a lot of responsibility in them, and we hardly see any drop. And we have seen a beautiful follow-up done by patients when they are well informed from the time of their first entry to post-op. So what do we tell children? We tell them to be themselves, and we tell them to be comfortable in their skin. So we just tell them never to be ashamed of a scar, because it simply means that they have been through what is cannot hurt them anymore. So this is one initiative where our team have been to the school, and we have given a cleft support team. We contacted the school authorities. We did an awareness program on orofacial deformity, and we did talk to the peer group about why it's important to give mutual respect and acceptance to their peer who has a condition. This is a picture of the beautiful package that the children made and gave us as a basket of happiness, as a gratitude to the session that we did for them. So what do we see in schooling? A lot of children avoid going to school, so absenteeism rates were increased. There were poor academic performance attributed to this condition, and there are many children who faced a lot of depression because they couldn't participate into interviews, they couldn't participate into group discussions for higher studies. So this is where in the multidisciplinary team, once we identified, there's rigorous speech training and sometimes a rigorous career guidance support also given to these children in the OPD. We have adults, early adults who walk into the clinic for psychological counseling because of workplace stigma, job discrimination. So we help them to transit into this. We help them to do a SWOT matrix where it is strength, weakness, opportunity, and threat. And we tell them how they can focus more on their strengths. And we see there are a lot of denial and feedback for matrimonial prospects as well. So this also causes some amount of anxiety into people because it's getting delayed, and there is anxiety of aging, there is anxiety of settling down late in life. So these are also some aspects which we have to deal when we deal with population of adult in CLP. So want to share with you a case study of one Mr. S, who was a very cheerful boy who completed his class 12th and joined the college, but developed low self-esteem because of bullying. As I told you, in school, he was super comfortable because everybody knew about his condition and he was accepted. But when into engineering college, his acceptance became low. And the Cleft counseling team had to give him a CBT, which is a cognitive behavior therapy. Not only him, but we also counseled his parents, and we helped him to participate in the program motivational camp, which was organized at Chennai by the Smile Train Foundation. Thanks to Smile Train Foundation, this program made a lot of difference to him. He saw how the other peers, were going through similar issues and are successful. And he's now a commerce graduate and he's into agri entrepreneurship. So these are some things that patient has told us while we counsel them. Some children ask us, why is this way I speak? Some children ask us, others don't understand because of my nasal voice, and that's why I remain to be silent. Some children are increasingly addicted to WhatsApp and Facebook because they don't want to talk, but they just want to observe. And there is a higher level of fear of missing out, which we call FOMO among children. There are some happy stories also from the OPD where people have met long distance, and this girl who had cleft lip palate was extremely anxious about how the boy is going to accept her when he comes down to India and see her. But this fairy tale bloomed and they got married. There were many girls and young boys who have told me that because they had difficulty in communicating, they even decided that they would not get married because they were feeling very socially unaccepted. But then now they are happily engaged. And there are two friends who both have CLP, and they have dated and they were best friends in school and now happily married. So we have a lot of invitations also coming up in OPD, which gives us a sense of achievement and success. So we focus on adolescents and teens where we resist negative social attitude. We have social support network. This is a picture of where we visited a village, a rural tribal village, to create this awareness, because there are a lot of consanguineous marriage and other thalassemia majors and other congenital deformities also, which is in this village. So we have taught these children coping strategy, given timely intervention. We help these children with CLP with problem solving. We do restructuring of thoughts, which is CBT, which is a psychological technique in regulation emotions, and we do conduct motivational workshop. So this is a picture from Chennai where my teammates had accompanied the adolescents to the Smile Train Cleft Con. So how we help the transition? We help them to appear into job interviews where we create awareness about how they can present themselves. Premarital counseling is also given for adults to transit into marriage. And most of time, they will have a lot of anxiety whether my child would also have such a condition. We also give them genetic counseling, and we help them how to meet new people and transit into work environment. So this is what Ganga multidisciplinary team does in building a positive outlook. So we look beyond scars. We work as a team. We focus on acceptance, social interaction skills, social competence, and ability to adjust. So we have this Cleft Q framework, how we assess. We look at what distractions they have about appearance, facial functions, and then their quality of life. So we look at psychoeducational, neuropsychological, and comprehensive psychological of children. We look at internal focus of the child and adolescent, adult. We look at external factors also that affects them psychologically, and we deal with each of them during their visits. So it is calendared and it is communicated to them what is going to be addressed during their next visit, so that they are also informed and prepared for it. So these are some of the supporting steps we do. We not only look at physical, but we look at emotional, cognitive aspects also. We educate the parents, and a lot of adjustments are done. So this is everybody's responsibility. So not just the psychologist or not just the nutritional or the speech therapist, but every quarter we conduct a session here where we educate our entire Cleft team, the support staff also, how they have to support the parents, how they have to support the child during, before, during, intra-op and post-op. We have created community awareness program, a lot of awareness program. This is a picture of when we did a program to RBSK to educate, create an awareness that such services are available. We do continuous breastfeeding on breastfeeding 7th August every year. We communicate. There are some societies where they don't understand presentations. So we have a trained group of our nursing students in role play sessions where we do role play, street play to create community awareness about acceptance for cleft palate and cleft lip. We have this exclusive event at Ganga Hospital called Spotlight, which is conducted in every May. And this is a talent show where children who have passed through surgeries come up and show their talents. So this is the artwork by our cleft warriors operated at Ganga Hospital. So you can see a beautiful dancer. There is this child who is excellent in singing now, so that much of confidence. There's a mono act done by another child. So these are the outcomes of the multidisciplinary team. Our warriors showcasing their drawing and art competition. We also saw the proud mothers, and siblings of the warriors. And this is a group snap that I wanted to share with you of how we work. So thanks to my Cleft team at the hospital, Each of us bring a different set of competence. Otherwise, this would have been really impossible to bring from papers to practice. So coming together is a beginning, keeping together is progress, but working together is success. And we strongly believe in this. So what are our future plans? We are looking at capacity building and creating financial independence for children with cleft lip palate, building self-esteem and self-confidence, satisfaction with speech language training. We are also looking at psychosocial strain and conduct problems, also help them in development. So these are some of the initiatives that are in the pipeline. Thank you very much for the opportunity.
Thank you so much, ma'am. That was a really wonderful presentation.
Thank you.
Very, very exhaustive. And those pictures of those happy, smiling faces, really, ma'am, it's very, very heartwarming.
Thank you.
Would the chairpersons want to make any comments?
Wonderful lecture, ma'am, Parvat ma'am.
Thank
You
you.
have covered psychosocial aspect of the children wonderfully, and you are doing a wonderful job. Just one question that how to counsel the couple when they had diagnosed cleft lip palate on early scan. Because one of my patient, the husband was having already, it was a case of cleft lip palate operated in childhood. And they had on early scan, 16-week scan, they diagnosed cleft lip palate. We counsel them with our plastic surgeon, with our pediatrician, even but we were not able to counsel them to continue the pregnancy. They opted for termination. Then can you give us some tips how to counsel these patients?
Sure, ma'am. So what we do is when there is a referral from the gynecologist, every Thursday in Ganga Hospital, we have interdisciplinary cleft clinic. So we coordinate with the gynecologist, take the number of the patient, and we invite them to this integrated cleft clinic. And we educate the patient. We have a module where we educate the patient about before and after. We also give a trajectory of how the whole process goes through. And every person in the cleft team talks to the patient. The surgeon talks, the psychologist talks, the speech therapist will talk. And we also let them, interact with other parents in the waiting area. In fact, we have seen over a period of time, parents of children who have come to cleft clinic and getting treated with us want to talk to these parents to tell them that how the whole that has worked better than any of us talking. So we have seen that this peer group counseling that happens, it works better than any of us talking, because when we talk initially, they think we try to convince them. But when the real talking happens from the parents who are going through the whole treatment, it gives a lot of reassurances. And in the last 2 years, we have also seen that most of them have delivered, hardly any termination, should say zero. Most of them have delivered and they've come back to us on the 8th day for NAM. And so the whole journey has started. So we are collaborating with the Coimbatore Obstetric Society on this, madam.
Okay. Thank you, madam. Thank you. Then peer group counseling is
works best, ma'am. Okay. Yes. Every time when people come to your OP, you will normally know who is good at talking. So what you can do is you can train them. So a little bit when you train them, they will be able to do the support group counseling actually works. Only after the real journey of cleft lip palate starts, they start bonding with us. Until then, this peer group has worked 80% of the times for us, ma'am.
Okay. Thank you. Thank you so much.
Thank you, ma'am.
Narendra sir, for your comments also. Thank you, Dipali ma'am. In spite of difficulties, you have been able to join us today.
Thank you, Monica.
Yes. It was a very good lecture, madam.
Thank you.
So I was not aware of that such things are also happening, and there is a group and whole team for counseling of the cleft lip and cleft palate patient. Currently, I am having one patient who has terminated her first pregnancy for cleft lip palate. Now it is recurrence. So I counseled her कि we did her genetic workout babies and it was normal. So the pregnancy is continuously going on now, and I will be happy if I can send that patient to you for further counseling and management. Uh, it
My
was very
pleasure,
good.
sir. My
Yes.
pleasure. I can even, if the patient is in Maharashtra, I can even connect with the patient online and I can help you on that, sir.
Okay, that will be very
Yes.
good.
I was
Because
born and brought up in Maharashtra, so communication would not be a problem to connect to the patient.
okay, definitely will do. Now she is almost 35 weeks completed
Okay,
and will be
perfect, sir.
delivering in next month.
Sure,
Uh,
sir.
yes, very good information, madam.
So one
Okay,
antenatal counseling, I can support you, sir. You can ask your secretary to connect the patient to me, sir. I'll share the details. I can do an antenatal counseling to the patient before she delivers so that there's no anxiety postpartum.
definitely I would like for that. How to contact you
Sir,
and
I will share my mail ID and my phone number to you, sir. I will share it
yes,
through the Smile Train group.
yes, okay,
Definitely, sir.
yes.
I can help you on that. My pleasure, sir.
Thank you, ma'am.
Thank you,
Yes.
sir.
Thank you, Parvati ma'am. It was an excellent presentation and almost all our doubts have been solved. Thank you,
Thank you, ma'am.
Narendra sir, for joining us. And I think the purpose of this webinar solves when we can cater to these patients effectively and with a live example today, and increasing the awareness for the counseling in these patients to continue the pregnancy is the main goal that Amox and Smile Train both have been striving for. I think today the purpose has solved, sir.
Yes.
Thank you, Parag sir, and thank you, Sarita Balaram madam. Thank you, Kiran sir and Bipin sir, for allowing us to conduct this under the Amox banner. I would also like to thank our chairpersons, Dr. Smita madam, Dr. Dipali ma'am, and Dr. Narendra sir, Dr. Ganesh sir. Dr. Sadanand sir could not join as he is operating, and Dr. Manjusha madam is traveling, so there is a network issue. And I also thank our speakers, Dr. Charulata Bappai Madam and Dr. Parvati for their excellent deliberations. Dr. Supriya Arwari as my co-convener, the Smile Train, Dr. Renu, and Harsha for the technical help. Thank you so much, everyone. It was a wonderful evening and academically spent. We will see you next on the 24th of May.
Thank you so much,
Thank you so
Monica, for all
much.
the hard work. Thank you. Thank you, Parvati
Thank you.
ma'am.
Thank you.
Wonderful talk.
Thank you. Nice meeting you
Thank
all.
you,
Thank you.
Harsha, and thanks
Thank
to all
you,
the
ma'am.
chairpersons.
Yeah.
Thank you, Charu. Thank you, Parvati ma'am. Zopesh sir is still there. Thank you so much, sir. Kulkarni ma'am.
Yes.
Dr. Priya. Thank you so much.